Good afternoon, everyone. I was waiting for 4:02 to show up on my phone, and it has. And I want to thank you all for joining us today. This is the fifth session in Data Comes in All Sizes. And today it is the topic of data interpretation and impact. I did want to note that in the chat, there is the survey. We do hope that you do take the survey. You can take it at any time. And then also, a reminder, and we'll remind you again, but you will need to register in advance for the last session that will be on December 9th. And so please make sure that you do register in advance for that particular session. You will get an email after this presentation with some homework and also with the link to this new registration. So we'll give you a couple chances to go ahead and register for that. So again, I want to thank you for joining us, and we'll get started. So Dorota Carpenetto has joined Mountain Pacific Quality Health in April of 2020, and she was a project manager on the analytics team. She is responsible for supporting the interpretation, the summarization, reporting, and presentation of data in a way that is clear, accurate, and meaningful to quality improvement efforts. Dorota has 14 years in public health practice, which includes 12 years working as an epidemiologist at the Montana Department of Public Health and Human Services. She also has 3 years of experience working abroad on public health and environmental issues. So Dorota has a BS in International Business and a Master's in Public Health from Tulane University. Her favorite part about data is bringing data to life or putting data into practice. So I'd like to welcome Dorota, and she's going to start on our session today. Thank you.
Thank you, Sarah, and thank you to those coming back for my second data session. Warm welcome to new attendees. I hope that you will find today's session worth your time. Today, the presentation will focus on basic statistical concepts such as proportion, rates, and few definitions. I will spend some time talking about data analysis and interpretation. Together, we will walk through an example of how to analyze and visualize data. I will cover the importance of results dissemination. And lastly, we will go over homework assignment for our final session, which will take place next Wednesday, December 9th. Next slide, please. In the next few slides, I will review the 4 basic statistical concepts, such as counts, ratios, proportions, and rates. I know that many of you are using these terms on a daily basis without even thinking about it. These 4 terms are really the foundation of many important calculations, such as the disease prevalence and the disease incidence. Oftentimes, it can be tricky to distinguish these differences between rates or proportion. So what we're going to do right now is to dive into each of these concepts. Next slide, please. Count is the basic, really, statistical measure. It is used every day by everyone, regardless of what field they are working in. Another term that analysts use for count is frequency. Count or frequency can be also referred to as number of events. It's just saying, for example, how often something occurs or the event. Count is expressed as a number. This picture is a picture of a physician named John Snow from London. He spent decades studying cholera in systematic ways. He collected data such as counts, studying the patterns of the disease. His experience helped him to identify the source of the outbreak that came from the water pump in the Golden Square area in London in 1854. The water pump is indicated in this map by the red square. John Snow simply drew a map of the Golden Square with dots representing people who fetched the water from the pump and later got sick with cholera. As a result of his data investigation, the handle from the water pump was later removed to prevent further outbreak. Next slide, please. Now it's time for our first statistical definition, which I will often reference in my slides. Numerator is the number on the top of this equation, and the denominator is the lower number of the fraction. Usually it is the larger number of the equation. If you get confused between which is the numerator and which is the denominator, just think of denominator starting with the letter D for down. Next slide, please. Now let's talk about our second statistical concept, ratios. Ratio compares two numbers of two different things. Example, two different diseases, dividing one quantity by another. Let us assume one number is X and the other is Y. For example, let's say we have a group of 15 people. 6 are females. This becomes our numerator, which is also our X. And we have 9 males. This becomes our denominator, which is also our Y. So the ratio becomes 6 females to 9 males. Pretty simple, right? Well, the X and the Y can be related or completely independent variables. A variable is a simple data point. In this example, illustrated on the slide, the variable is gender, and the categories are males and females. Ratio can also have completely different variables for the numerator and the denominator. For example, the numerator can be number of hospitals in the city, and the denominator can be the size of the population living in that city. We really need to understand how to set up ratio in order to calculate relative risk or odds ratios. But I won't go into the definitions in today's session because it could be a whole separate session. We are simply looking at how to set up the ratio equation illustrating the numerator and the denominator. Next slide, please. The next statistical concept I'll review is the proportions. A proportion is a special kind of ratio, which we just talked about, because the group affected or the numerator must be out of the population at risk, which is the denominator. Simply, when calculating proportion, the numerator is also included in the denominator. So it's the bottom part of the equation, right? In our example, I have some fake data illustrating that 60 out of the 100 people from around the world said they never received a phone call in their life. So our calculation would be 60 divided by 100, which is a fraction of 0.60, that you can convert to a percentage by multiplying it by 100 and get a 60%. So yet proportion can also be expressed as a percentage. Next slide, please. Our last statistical concept is rate. A rate is also written as numerator and denominator, but not like a proportion. Rate also has an element of time, like a year or a month or a day. To non-epidemiologists, a rate means how fast something is moving or going. Again, rate has that component of time. In our example shown on this slide, taken from the CDC's data query, we can see that there were about 250,000 new female breast cancer cases per 100,000 women reported in US in 2017. Next slide, please. Now it's time for our first polling question. Mary, can you please bring it up? Okay, so I'd like you to think about this question and tell me, what do you think, if it's a ratio, proportion, rate, or none of the above? So the first question is, the number of women in Alaska who died from heart disease in 2019 divided by the number of women in Alaska who died from cancer in 2019. So numerator over denominator. Is there a ratio, proportion, or rate? Now, the second question would be number of women in Hawaii who died from heart disease in 2019 divided by the number of women living in Hawaii in July 1, 2019. Is it a rate, proportion, or a ratio, or none of the above?
I'm just
Please take a
checking,
few-
has everybody have the poll? Did it come up on your desktop? There, I see some people getting some numbers coming in, so I just was curious.
Please don't hesitate. It's okay if you get it wrong. It's often confusing, so I like for you to cast your vote if you can.
Yeah, I wanted to do it and I can't. I just get to see the progress, so bummer.
Okay, a couple more seconds. That will tell me how good of a teacher I am. All right, I think we can close the poll now. Great. So the answer to the first question, it is a ratio because we're dividing two different things, right? Two different diseases. Very nice. I see that majority of the people got that correct. And the second answer is rate. And we, yeah, again, mostly those who voted chose the correct answer. So thank you for doing that. Just as a note, this example was adopted from the CDC's principles of epidemiology and biostatistics. So thank you for taking the poll. Next slide, please. It's time for another definition. I don't know why this is a little bit cut off, I think. Okay. Great, it's just slow coming up. So let's talk about confidence intervals. I think this might be some people's favorite. Just kidding. Confidence intervals can tell us if two estimates or two different numbers are statistically significantly different from each other. So overlapping confidence intervals indicate that there is no statistical significant difference in two estimated numbers, where non-overlapping confidence intervals indicate that there is a statistically significant difference between two estimates. Let's take a look at an example illustrated in this slide. Assume that we surveyed 9,000 people. In this example, on the top, we see that we have an estimated rate of 13.9 of women smokers in Montana compared to 10.3 of women who smoked in Wyoming. Now, the way we read the estimated rate with the accompanied 95% confidence interval that is included in those parentheses, we're saying that we are 95% confident or sure that the true value, in this case, let's say the 13.9% for Montana, falls between these two numbers, this 11.8 and 16.0. Same thing goes for Wyoming. So really, it's like our range and that percentages falls somewhere in that range. Now, let's say that you wanted to check if those two rates as statistically significant, if they have significant differences between those two rates. So you can see the confidence intervals displayed in the purple line for Montana and the blue one for Wyoming. Well, now, in the first example, these lines are overlapping. Therefore, we can be sure that there is no statistical difference between the rates. However, in the bottom example, we can see that those bars or those lines, the purple and the blue line, are not overlapping. Therefore, we can tell with certainty, or we are 95% confident that there is a statistical difference between the 13.9% and 10.3% rates between these states. Okay, next slide, please. The purpose of data analysis is to bring order to the data by sorting it out and trying to make sense of it. Commonly used analysis for this group, I think, would be the descriptive statistics which include analysis of quantitative data. Remember from our last session, quantitative data simply refers to numeric data. Descriptive statistics can include counts, rates, proportions, basically the stuff we've talked about. When analyzing data, we often begin by conducting exploratory analyses. Exploratory analysis puts emphasis of learning from the data, which appears plausible in the light of evidence. During exploratory data analyses, we frequently make a lot of charts and data summaries, and we slice and dice the data numerous ways to figure out what the data are telling us and what would be best way to display it to help us communicate the findings with others. Next slide, please. I want to share a quote with you by Peter Kennedy, well-known professor of economics, who said, "Exploratory data analysis is an approach to statistics which emphasizes that a researcher should begin his or her analysis by looking at the data on grounds that the more familiar one is with one's data, the more effective they can be used to develop, test, and refine theory. Econometricians are often accused of never actually looking at their data. Exploratory data analysts believe in the interocular trauma test. Keep looking at the data until the answer hits you in between your eyes." Well, I like that because sometimes it takes a very long time to figure out what the data are saying. And when we finally realize it's in front of us, we know that we can apply that in our practice, or hopefully we can do that by just exploring the data. Next slide, please. Now I'd like to emphasize a few points for data analysis and interpretation. One, the importance of involving your data people from the very beginning of your project. Oftentimes, we are so focused on doing our jobs that we miss the opportunity to collect valuable information from the project inception. It is later difficult to go back and collect that data, or to design an effective evaluation plan to show the effect of the intervention on a specific population or system. Second, I like to say that do not be afraid to look at a draft data, share preliminary data. Many times in public health, we don't want to share the data because it's not perfect, meaning it might be in draft form, or it might be 90% complete, because for some reason you can't get that 10% of your data to make it final, and you hold on to it for a long time. And by the time you get to it, it's too late, or we missed opportunity to make correction in our intervention. Remember, it's okay to run preliminary analyses and share the findings with your team and make some assumptions, taking into the consideration the data limitations at the point of the presentation. Finally, when you share your data, make sure you document your data source, meaning where the data come from, your limitations, like I mentioned, say it's 90% complete, or that these are preliminary findings. Make sure you note your inclusions and exclusions. For example, you could say these data include population aged 65 years and older, and exclude anyone with A1C greater than 9. Next slide, please. It's time for our second polling question. Now, I would like for you to take a little bit of time and tell me if you have a dedicated data person at your workplace and how comfortable you feel analyzing data. Okay, maybe 2 more seconds. Cast your vote or your answer. All right, I think we can close the poll now. Great. It seems like over half of you have a dedicated person to analyze the data for you, which is great, but there's also some of you who have to do it yourselves. I know it can be really difficult, time consuming, and you're often not sure if you're doing the right or not. So hopefully these sessions will give you some new information that will help you do that. It seems that I have about 44% who are pro and love data. Great. Hopefully that's why you called in to share my love for data. And of course, with those have people who don't like data at all. And I know many of those people myself. So that's why we are here to do that for you. So thank you for sharing that with me. Next slide, please. Now, I'd like to share one of my favorite resources for data visualization. It is this little orange book pictured on the left side of my slide called Effective Data Visualization, written by Stephanie Evergreen. This book provides many examples of data visualization with step-by-step instructions how to build specific charts in Excel based on the type of data you have. On the right, you can see the summary cheat sheet included in this book, which helps you choose a chart based on the data you have. Let us take a closer look at a couple of these examples. The first one is, we're going to take the very top one. It says, when a single number is important. In this case, the best way to visualize the data are the following. Simply just write one number, use a big font and bold font, and bring the attention to the data. The second way, you can use an icon array, which shows orange dots out of the 6 dots. Remember when I was showing my example with proportions and the people who never received a phone call in their life, I had the picture was a different icon. It was a person icon, but it was pretty much the same concept. And another way to visualize a single point of data is you can do a simple graph with bars and just change the color of the bar that you want to highlight. For example, here, notice you have the orange bar that's highlighted, meaning that that's the point in the data you want people to pay attention to. Now let's look at another example, the third one down. Here we want to show how we are better or not than a benchmark. Well, we can visualize the data in several ways. We can show a benchmark line, which has the same value for all comparing groups you presenting in that graph, or you can use a combo chart. In this example, each of these blue bars have different benchmark so that the line isn't straight like in the first graph. You can also use what's called the bullet chart, which is a relatively new type of chart. The shaded level of green of gray represents different degrees in your benchmark. For example, it says on a scale of like 1 to 10, or from fair to excellent. And the blue is your progress. The red line would be your target on the benchmark. And the last chart in this category is called the indicator dot. Here we have the colored dots markers indicating where the target was met or not. These type of charts are handy when comparing matrix between maybe different regions or states. So go ahead, go on to the next slide, please.
I have a specific question about this, so I just was curious. I think this is a great tool to use. I love it. I was curious, though, how many pages that book is, because this is a chart chooser, but I was curious how detailed that gets.
Yes, a good question. It's about 300 pages.
Okay, wow.
But this is, it's really, actually, it's got a lot of graphics in it and step by step saying, hey, you have the ninja skills. Don't be afraid. Here's where you click. So there's a lot of screenshots involved. That's why it's more extensive, but it's not like any other book you pick up. It's just a bunch of text you have to read through. This person really knows what they're doing when they're help you teach something. So I highly recommend it, but I just so you know, disclaimer, I don't get any profits from sale of this book. So
okay.
Yes, great. So
thank you.
You're welcome. Okay, well, now let's go through an example using a template that's also included in this book. By answering these 4 questions, we can sort out what information we need to communicate our data findings effectively in a short period of time. I included some fake data in the table illustrated on the right side of my slide. Now I will go over the data and next we will answer these questions. So this table has data from 3 different facilities, A, B, and C. Each of these facilities have only 2 data points, which is the percent of residents aged 60 years and older who received shingle vaccines in 2019. And the second data point is their benchmark or their target that they're trying to achieve in 2019. Now I'll answer my 4 questions. You see that I don't give long answers for each of these questions, and my answers are indicated in that burgundy color, reddish burgundy. So we're trying to use this template really to, well, using this template is sort of an effective way to take out the noise out of the data to help us summarize what we're trying to say. Because sometimes you're going through this exercise or experiment with someone else. So it's helpful to have a guide. So let's look at question number 1. What's the point? Well, my point here is that I wanted to look at the data to see which of these 3 facilities met their benchmark. The second question is like, who's your audience and how will you be delivering this to them? Describe their data needs and literacy, what softwares or platform you're using. Well, I'm planning on presenting this information to the board of directors meeting, and they're very busy people and don't have a lot of background or knowledge about this data. I will use Excel to do my chart, and I put that in a PowerPoint presentation for my presentation. And the third question is, what is the best chart type for this information? Well, I went back to the cheat sheet and I said, what information do I have? I am looking to see how better am I or those 3 facilities than a benchmark. So of course I chose the combo chart. And the last question, and how can you sharpen the point that you're trying to make with this data? So I can already see from my data that none of these facilities met their benchmark. That's what I wanted to highlight. Next slide, please. As I mentioned, the chart I chose was illustrated in that summary sheet, and I chose the combo chart because I'm comparing the vaccination rates to the benchmarks. Many people get overwhelmed looking at charts during a presentation. They don't have time to interpret what's in it. Sometimes they just want to read the text. That's the title that's on the chart, but still that might not be clear. The best way to illustrate your data is by having the chart accompanied by a short interpretation in the title. So instead of just in one quick sentence, you can tell a lot about data, what's in that chart. So this way someone doesn't have to focus on the chart, they can just focus on the text. In this example, I say none of those 3 facilities met performance benchmark of vaccinating their patients for shingles this year, or you can also add the year to it as well. I reserved to include that information in my text that will be accompanied with my chart later in my later slide. This way, the chart doesn't really get busy and it's much simpler to interpret. Also notice how I took out the extra bells and whistles that comes automatically with the template chart when you insert it in Excel. I do not have the percentage signs on my right axis. Instead, I've included that next to the numeric value. I took out the legend and the horizontal outlines, that the lines that go often in the background, I took those out as well. I matched the colors in the title to bring the attention to the benchmark color, that reddish burgundy color. So really, bottom line is the simpler the better, and easier to interpret, especially when you're delivering a presentation. Next slide, please. So we already established that none of those three facilities met the benchmark of vaccinating their patients. And we also have a chart to illustrate the data. But what is the story that we want to tell with this chart? Well, we can include few bullet points with the data interpretation to accompany that chart. We can say the following. In 2019, among facilities included in our study who offered shingle vaccination to patients aged 60 years and older, none of those three facilities met performance benchmark. Facility B was the furthest away from meeting their benchmark, and facility C was the closest to meeting their benchmark. You can also calculate how far they were from meeting the benchmark if you like to do that. But as you probably have observed here, I've included the extra information I was mentioning earlier, like the age and the year, just because I have the text that comes with the slide, with the graph. Next slide, please. What about communicating and disseminating your results with others? These are very important things to keep in mind. So what does communication entails? Well, communication means taking strategic and targeted steps for promoting the action itself and its results or successes to different audiences, including the media and the public, possibly engaging in a two-way conversation exchange. Whereas dissemination means sharing data results with potential users, including peers, policymakers, or general public. Communicating and disseminating information evolved so much over the past decade. It used to be that we spend a lot of time producing lengthy data evaluation reports with complicated charts that you would have to think twice about reading because it took so long. That format definitely wasn't easily digestible for practitioners or decision makers. Then we gradually went to fact sheets, and now some of our well-recognized leaders convey the policies in a single tweet. However, we won't reach everyone with the same communication and dissemination methods. Some of the audiences and effective ways to communicate with them is via fact sheet or infographic or postcard, and of course, social media posts like Facebook. Next slide, please. So now let's look at our homework assignment that we will work on during our next session. This table contains fake data that you will be able to download along with the information on the next slide right after this. Well, actually, we won't be downloading it. You will be emailed these two slides right after this session. In this table, you see 4 different services offered by Valley Community Medical Center in 2019. I included inpatient costs per member per month for each of these services. Next slide, please. Based on the data table I just shared, please think about how would you answer these 4 questions and what conclusions you can make from the data findings. You saw the exercise I walked you through. This is pretty much the same thing, just the data are different and also fake. So these 2 slides, this one and the one before, will be emailed to you for the next session on Wednesday. Next slide, please. Because only a few people filled out the evaluation in my last session, I would like you to take a couple of minutes to answer the evaluation questions now before I go to my next slide. Don't worry, your results won't be shared live with anyone. They are confidential, but very valuable for us to make improvements for future sessions. Please don't disconnect when you're done. Answer the questions. I have more slides to cover, so please take a couple minutes to answer the evaluation. Thank you. I'm very excited. I haven't lost anyone yet. Okay, I think we could probably go on to the next slide. Yeah, so next Wednesday on December 9th, we will break into small groups to work on this homework assignment that you will be emailed. And then we'll report back to the group. After that, I'll provide some data templates, like chart templates that you will be also able to have access to. We probably will email you the Excel sheet with some fake data, and then you can put your own data in there. Hopefully those could be useful for you. And lastly, I will share some data sources that you can go in and query that you might be able to use in your work to complement the data that you're already using. Next slide, please. And now it's time for questions. I don't have any more slides, so.
Now, please feel free to either chat, or we could actually open up the lines. And if you had any questions, anybody have anything? I do want to confirm you will be getting, I think, the slides, and I know that in the homework you will need that one page to look at what type of chart you'd be using as one of the questions you need to answer on that homework page. So you will have that to reference. No questions? Well, I hope that you all joined the last session. Thank you very much for joining the 5th session here. And we really look forward to working through that homework project and also getting some wonderful input and data from resources and everything from Dorota. So if there's no questions, I want to thank you again. Please make sure you have done the evaluation and look for the email with the homework included. So please join us next Wednesday.
Thank you, everyone.